Hello, 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 everyone. Welcome to another episode of Sree's daily global COVID-19 show. My name is Sree Sreenivasan, and I'm the Marshall Loeb Visiting Professor of Digital Innovation at Stony Brook School of Journalism. It is my honor to convene this daily conversation around various aspects of COVID-19. We discuss three crises here: the health crisis, the financial crisis, and the racial inequality crisis. Every episode tackles these issues in different ways. Today, we have a very special episode for you, a survivor story. You're going to meet Mrinalini Nair of New Jersey as she shares her story of surviving COVID and the lessons we all need to hear. She's written a very important essay on what happened to her and her family, and she's here to share her story with us. She'll join us in a few minutes, so please stay tuned. In the meantime, please tag and share this with all your friends. Everybody needs to hear this right now. We're live on Facebook, on Twitter, on YouTube, and on LinkedIn. Please make sure that your friends and family around the world can watch and learn from Mrinalini. Hi, everybody. I'm Sree, and we'll be joined by Mrinalini Nair in just a minute. I want to tell you that this is episode number 112, 112 episodes. That means we've been in lockdown in New York for 112 days. And in many ways, it feels like all the sacrifice made by the 125,000 people who have died, the thousands and thousands of other people who've had coronavirus, the people who lost their jobs, 40 million people, all of it seems to in some way have been for no value at all in terms of learning any lessons, because we are seeing how America is now responding to the virus, where we have tragedy after tragedy unfolding in real time before our eyes. A president and a vice president who are not doing what they should, a failure of leadership at the highest level, multiple governors failing to lead the way they should. At a moment when we were needed, where we needed the best leadership in the world, we got the worst leadership in the world. No other way to explain how America, in the middle of its first wave, is already experiencing everything that comes with a second wave. No other country is going through what America is going through now. And we're here to learn and understand on this show. And today we have a guest who's been through the coronavirus herself and wants to share her story so that people will understand what this is. And we especially want to talk to young people in your lives and others who are not taking this seriously. Please watch this and learn from Mrinalini and her story. You'll meet her in just a minute. First, a big thank you to all our viewers around the world. Thousands of people watch all our episodes, and we are so grateful for the messages you send us, the notes you send us, so many ways in which I have learned and grown through these 112 days. And I'm so grateful to everyone who's watched. We're also grateful to our producers, Vandana Menon, Vandana_Menon, and Rose Horowitz 31. They're both on Twitter. They're live sharing, live tweeting, and we hope all of you will take a look at what they're posting. We also want to thank our sponsors who make it possible for us to do shows like this. And our sponsor is globalentrepreneurshipexperience.org from Rutgers University. And you can take a look at this virtual teen camp for anyone who has a teenager anywhere in the world. They can attend this course. Google, Facebook, Angie's List, Cognizant. They have great speakers and 20% off with the code SREE. They have 2 one-week sessions. They're duplicate sessions, so they can attend one or the other. Please use the code 20 for 20% off SREE, and please do tell anyone you know who has a kid or a teenager in their lives to take a look at this and explore this. Well, that's one of the things we're doing, is trying to see what can people do in the middle of this pandemic. And we also want to thank Muckrack Academy for allowing me to put together a fundamentals of social media certification course. It's completely free and available right now. mrac.co/social, mrac.co/social, the basics of Facebook, Twitter, Instagram, and LinkedIn. And people are taking it. More than 4,000 people have signed up around the world, and we're so grateful to them for taking the course. So please share this. Take a screenshot or take a photo and send this to people you know, because this is one of the things that they can do is upskill their social media knowledge at this moment. And with that, we are ready to bring on Mrinalini to talk to us, to share with us her story. And we want to remind you that you can find her story. She has written about it, bit.ly/COVID essay, bit.ly/COVID essay. We'll show you that essay in a little bit. We'll break it down with her, and she'll tell us her story of surviving COVID and the lessons we all need to hear. So with that, I'm going to bring onto the stage right now my friend Mrinalini Nair. Hello.
Hello. Thank you for having me. I really appreciate this opportunity to spread awareness about the COVID and my COVID experience.
And we want to make it clear, this is one person's story and one family's story. This is not representative of everyone, and everyone should talk to their own doctor. This is not medical advice that we're giving you here directly, but just we want you to think about what you're about to hear from Mrinalini and her story. It's so important for everybody. So let me start by asking the question I ask all our guests. It's a little different to ask it to you because we know you've had coronavirus. We had Bill Ritter, the great anchor on New York City television. He joined us while he was recovering from COVID-19 and has made a great comeback. But let me ask you, how are you and how is your family?
We are all good. I am actually in the process of recovering. I say in process because I still have some days where I have random pains. For example, the past couple of weeks, my hair has been falling out. So still kind of feeling the bites of the bug, so to speak, still. My sons and my husband have recovered. My younger son still has a little bit of a rash that we're hoping is going to go away, but just a fingertip left. So yeah, it's been 12 weeks and we're still slowly untangling ourselves from this experience.
And it's hard to believe that it is, as complicated and as painful as it is, as it has been for you, considering how dismissive people are of Corona in so many ways. And we'll talk about that. We did a nice little prep session, you and me, just before we went live. And of course, the lighting was perfect. And then I guess the sun went behind some clouds over there. So
it's raining.
So a question, is there a light, overhead light that can be turned on? I will take you off camera for a minute.
Yes.
If you want to just put on a lamp or something.
I can do that, yes.
Okay, thank you. And folks, that's Mrinalini. She's with us. She's going to share her story of coronavirus and what she learned along the way. You will all benefit from taking a look at what she's been through. I also wanted to mention that we are involved, my company Digimentors, which does social, digital, and now virtual events consulting, is executive producing another show that's kind of a spin-off of this, and it's called She's on Call. And this is a show where two of our doctors who you've seen multiple times on the show, Dr. Sujana Chandrasekhar and Dr. Marina Kurian, both of them are hosting this show, She's on Call, and they talk to other doctors and other interesting folks. And so last Sunday, they had Dr. Jordana Cohen and Dr. Olga Garcia. It's Sundays at 11 a.m. Eastern, and we'd encourage you to watch that episode, and please follow She's on Call at She's on Call on Twitter and on Facebook right now. And then this coming Sunday, they are doing a compilation show of their greatest hits because of the holiday for Independence Day in America. And then coming back on July 12th, they have another fabulous show. Dr. Quinn Capers and Dr. Susmita Pati will be joining them. So please take a look at She's on Call. They give fantastic medical and health information, a lot of it around COVID now. And when we were planning the show, we expected, maybe by this time we won't be as focused on COVID, but you can imagine that there's just so much we need to talk about. And that's why we're very grateful that Mrinalini is here, and she's giving me a thumbs up to say that she's ready and back with more lighting as we get started here. And hello.
Hello.
There you go. A little bit of, that's where the rain decided not to be cooperative with us. But
yes.
And I keep saying to everyone, we did a humor episode in the middle of this crisis, and we said, you have to laugh a little, otherwise you'll cry all day.
It's true, especially now more than ever.
Yeah. And when we see these headlines of every day rising numbers of COVID-19 cases in America, we're looking at Dr. Fauci saying there could be 100,000 new cases. 126,000 people have died already in America, and that's not even counting the rest of the world, where America still leads the way. So let's break it down a little bit. Start at the beginning. Tell us about your family story. Where were you when all of this went down, and how careful were you? Because as you know, what happens is if somebody gets lung cancer, the first thing everybody tries to do is ascertain, were you a smoker? Things like that. You found that already, right? As soon as you tell people you had the virus, people want to know, was it your fault?
Yeah.
What did you do that caused you to get this is one of the ways that people approach folks of this. I also want to say to everyone that we've had multiple people we know who had coronavirus. Many of them have gotten better and are like Mrinalini, are safe and sound or recovering. But we've also had multiple people who have passed away, including dear friends. And we're so upset about the fact that people are so cavalier about this and people haven't been taking it that seriously. So please take your time. I'm going to let you just tell us all you want to, and we will show the article in a little bit as you're speaking as well. So thank you very much.
Yeah, no, thank you. Actually, just to kind of add, I think one of the things that I read today on CNN was America is 4% of the world's population. We have 25% of the cases. I mean, that's pretty compelling. Obviously, there are various reasons for that. But yeah, in terms of when we first got the virus, my husband actually got it on April 5th. He just had a fever, and I was literally waking up in the morning or in the evening. We were about to go to bed, and I turned over to give him a goodnight kiss, and he was burning up. We just looked at each other, and we knew that it had happened because we were in isolation at that point for 3 weeks. I think one of the things to note is we are we were really thorough. We live in Hoboken, which of course is not as highly dense as New York, but still is a relatively urban setting and has high density population. We were incredibly careful. We did not bring boxes in. We did not even go to the grocery store. We really mainly had deliveries from Fresh Direct. As well as, any other deliveries. We almost pulled out everything from the boxes before we even brought it into the house. And then even when we brought it in, we wiped everything down. So yeah, to your point, there's a lot of people who ask, how did you get it? Where did you get it? And the truth is there are very few people, now being part of the survivors crew, there are very few people who can really point to a specific incident and say, that's where it happened. I think most of us don't know unless they, got it from contact from somebody else who they know had the virus or was exposed to it. So in these random instances, there's really no way to tell. We also were super kind of cautious in how we isolated my husband. He went into isolation immediately. I slept upstairs. I actually took the kids with me the next couple of days so that he had a separate floor to himself. I, had food that I made and served to him. I would leave outside the door. We wore masks when we passed his room. We thought really thorough. But the next 2 days, my kids had started getting fever as well. My younger one had fever for 24 hours. And then luckily he showed no other symptoms. My older one, I'm not sure he had a fever actually, but he just seemed a little off, which happens. And my older child is 5, my younger one is 1.5. So it was a little bit of a tricky situation. And the thing was, I was really worried about my husband because he has actually an underlying condition, which they've identified as potentially something that's dangerous when combined with COVID, and he has blood pressure. So that was really a worrying factor for me. And as the kids got sicker, I was taking care of them myself. I ended up having to really like I started developing like lightheadedness. I started feeling weaker. I cooked a bunch of food because I felt that it was coming on. So I froze as much as I could just to last us, I thought, for a week to 10 days, because really that's how I thought how long this lasted. I was like arrogantly texting people and saying, oh, if this is it, I'm fine. But the truth is that it wasn't it. It wasn't done with me. I had a fever pretty quickly after that. I got sick with a fever 3 days after my husband. 2 days later, I continued to decline and I started feeling a tickle in my throat. The next day, I woke up in the morning. That was Friday morning. So from Wednesday to Friday, and my whole chest just felt like caged, like somebody had actually locked it up and taken away the key. So I couldn't breathe. Like I couldn't have like a full deep breath. I ended up going to the local city MD. They did an x-ray and confirmed that what I knew, which is that I had COVID. In the interim, we were waiting for my husband's test to come back. We had done the test through like the Hoboken system. At that time, the testing was honestly really, really slow. It took about 8 to 10 days for it to return. And by that time, we already had confirmed that I had COVID as well. In terms of the x-ray, the doctor at that point said, you'll be fine. You're young. Don't worry about it. And I even tried to get an oximeter. I couldn't get an oximeter anywhere. I think they were completely sold out. Amazon wasn't delivering. Luckily, I had a friend who dropped the oximeter off in front of my house. And that tool helped me save my life because I watched it every day in terms of checking my oxygen and heart rate. And I could see my heart rate increasing and my oxygen levels dropping. It was literally over the weekend, my oxygen level was dropping 2 or 3 points from like all the way from 98 to the next day. It was 94 to 92. By Monday, I was at under 90. And at that point, I called my GP and he said, if it drops under 90, you need to go to the ER. And so I ended up at New York Langone and went to the ER there. And they were amazing. I think the doctors, considering the fact that there wasn't, especially at that time, even less information than there is today. I think, of course, there's still no cure. There's still no like protocol or set course of how to deal with this virus, especially since it affects people so differently. But luckily for me, my husband got better by Monday and was well enough to start taking care of the kids. And I was able to go to the hospital and turn to kind of take care of myself. I mean, it was a really sad moment leaving my family and looking at my house and just being like, I'm not sure if I'm going to come back because you don't know what you're fighting and nobody knows. The medical community doesn't know. The scientists are still trying to figure it out. So when you're dealing with a situation like that, it's an incredibly humbling moment to know that you could be taken down by something like this. So,
wow. Thank you. Just hearing this, I've obviously read your story and I would encourage everyone to read it. It's at bit.ly/COVID essay. It's on the screen. You can see on the banner, you can see the address bit.ly/COVID essay. And it'll be also shared in the Facebook and Twitter links. It's so difficult to imagine thinking that you may not come back. That moment where you did all you could, right, for the family. You made sure your husband's there, and you made sure that you'd cooked enough and gotten enough. All you can. That's all we can do, right? And many people didn't even get that chance, where they just went in with a fever and never came back out. So there you are, you're getting ready to go to the hospital and you're thinking that this could be, one-way trip. I just cannot imagine what that's like. Who are you thinking of? What were you thinking about? Apart from the kids, obviously, and your husband second, right? I presume kids first, husband second.
Yeah, I mean, well, yes, all of them. So yeah, I might get a little emotional. Yeah, I think, I literally looked at my 2 sons and I thought like, I'm happy that I had this time with them and I hope that they remember me, and because they're so young, and my husband, I was worried for him as well. And later on, when we talked about it, when I returned home on the other side, he said those days were tough because he was taking care of the kids, and he was wondering if this was it, if this was it for him as well, in terms of if this is a life that he's going to have. So, yeah, and we have a 1.5-year-old, so that's not a fun thing to be a single parent with 2 kids and 2 demanding boys. So, on a lighter note, but yeah, it was really tough. I think people don't realize that. I think people think of the disease and the fact that you go through a fever and maybe you have pneumonia, but I don't think people think about the emotional side of actually going through it, the stress and the anxiety that your family is put under, because there are so many unknowns. And even the best specialists in the world are still, like I said, figuring it out. And we know more today than we did in the time that I got it. Just like, we knew more 3 weeks before I got it, meaning we were more informed, but every day they're learning so much. So I just feel like for those families out there, don't put yourself through that stress. It's try to take care and be as safe as you can until we know more. We're 6 months in, I think I heard on CNN the other day, from the first time it was identified in Wuhan. And we have so much to learn. And the thing about these, viruses and things like this, it's not something that is we're such a quick society. We expect, changes and things to happen so quickly. And we're so tech focused that we expect everything to be at a click of a button. But this isn't that scenario. This actually is reminding us how human we all are and how little we know about so much. So.
Thank you. I know how hard this is to talk about, and you haven't talked about this publicly. You wrote an essay, but you weren't speaking out like this, and you decided to do this because of what you're seeing others go through. And I think you would agree it's unnecessary what we're seeing, all the sacrifice that has been done in this country, and 125,000 people have died. And it's as if nobody learned any lessons from that. Nobody said, I want to avoid that at every cost. And instead, let's go out, let's be, at the bars, let's go out and not wear masks. A simple request like that, to please wear a mask, has not been said properly by the leadership of this country, and the leadership has failed us. Your thoughts?
It's insane to me. It's absolutely insane to me. I think the fact that I just wonder what could have happened if this had been a more organized, strategic approach to the whole pandemic for the United States. I wonder, not just in terms of the mask wearing, but also in terms of the research and kind of really having a cohesive approach worldwide. Even the whole conversation of, leaving the WHO and all of that, the World Health Organization, et cetera. I think it's just mind-boggling that these are the conversations that we're having. The fact that, we're trying to have another case in the Supreme Court against Obamacare, and taking that down at a time when so many people need health insurance is incredible to me. I've been on survivor groups now as a result of this. There's so many people, to your earlier point, who have literally posted pictures of their family members and said, I feel like my family member has died in vain, because the lockdowns are opening up and people are just running around like there's nothing the matter. So yeah, I think that there's an incredible amount of we all think we're invincible. I was completely guilty of that as well. But I think that there has to be a reality that sets in, that this is the new normal, that masks are the new normal, social distancing is the new normal, until we can really understand the impacts of this disease, as well as how our immunity works, quite frankly, which is still a big question mark in the air.
Thank you for sharing your story today. So many people are watching around the world. You should know you're helping folks by talking about this. Everyone who's watching me right now, whether live or later, please tag the friends of yours who are not listening to you because they think they're invincible because they're younger, because they think this happens to other people. Look at Mrinalini's story. Listen to her. She did not have underlying conditions. She got sick. She's still, in some ways, still ill and struggling to get through. And she's speaking out only because she wants to make people pay attention for no other reason. She has no incentive to come out here and speak, but just to help other people. I'm so touched by you doing that, and other people are responding right now. Furzin says, amazing courage. And my father's watching in Kerala, India, and he says, courageous battle. Hi, Acha, love you. Cannot imagine your situation, Mrinalini, where you're, just watching everyone kind of just go to the beach and just hang out and say that that's more important. My right to go to the beach is more important than anything else. And therefore, everybody's being affected. We on the Northeast were the ones who did the kind of biggest level of lockdown apart from Northern California and parts of Southern California. And we're now moving to another stage. And somebody might say, oh, well, this is all, another part of the country doesn't affect me, which is the way the people in those parts of the country thought of the Northeast. But we cannot think like that. We're one country, one planet. And this is where we are today in this terrible, terrible situation. Let's look at some of the other comments. Ashok is watching in Kerala also. It says, I'm your mother, Saroj's friend. So you're seeing it's this global family here. People are cheering you on. Ellen's watching from New York City, and comments are coming. Vandana says, sending you and your family love. We're seeing here so many comments. Aparna says, knowing people around our age who went with a fever and didn't know they'd come back out has been heartbreaking. And it is really something that we would never have imagined. Anand's watching from Andhra Pradesh in India. Jonathan's watching from Union Square. And Union Square is near where you were with NYU Langone. Let's give you a chance to give a shout out to your healthcare workers all around you.
Yeah, it was an incredible team. I mean, I have an amazing doctor, Dr. McKnight. I've been with him for 10 years. He actually saved my life in the past. He's actually my husband's doctor, and I stole him. And he was an incredible source of just, there were times when I spoke to him multiple times a week just because I had so many different types of pains. And he was just able to kind of really help me and guide me through the situation. There was also another incident where I ended up in the hospital, like I noted, and I had an amazing team that literally watched over me, helped me kind of sit up, do my breathing exercises. I mean, there were days when I felt incredibly terrible. One of the things about the pneumonia is that you actually have to sleep on your stomach. So the nurses kind of, give you those tidbits of like sleep on your stomach, make sure that you're, the blinds are open so that you have some light, some positive thinking. That does a lot as well. I forced myself to eat just because my appetite was gone. At that time, they were also giving people hydroxychloroquine. I wonder where they got that idea from. But so that was also a little bit of I think honestly made me sicker versus helped me. So yeah, it was an amazing team. Nobody had experience specifically in COVID. They were, residents or nurses from everything from child to cancer. I think my doctor was a cancer specialist, but New York Langone was incredible. I had I think at that time, everybody was able to have a private room. They had converted different wings of the hospital to give people space. They were very particular in terms of how they came into the room and the PPE that they wore. But yes, just an incredible staff all around. And I actually went back again after I was released. And the second time, they did just an amazingly thorough job. So I'm very thankful for everyone at New York Langone, the emergency rooms, the people who helped me through COVID, my doctor, Dr. McKnight, who, of course, is just an incredible doctor for me. So
thank you. And thank you for sharing your story. I know people are watching around the world right now. And folks, we're live right now on Facebook, on Twitter, on YouTube, and on LinkedIn. Please tag your friends. Please share this. By hitting share right now, you can get the word out and people can share it with their friends so that we all understand the extent of this crisis. And here we are at 126,000 people killed in America by this virus. I'm just going to show this map from Johns Hopkins as you look at this and you look at these numbers. Just so sad to see where we are with this. I don't know. Do you pay attention to these? Do you look at them? Is it too much for you to deal with?
Initially, it was, to be honest. I kind of had to pull myself off of social media. News. I used to watch the news really religiously, actually all the time. I had to switch off CNN permanently in our house. Literally, I think it was 2 days ago, I started watching the news again. Of course, you can't really escape the media. They find you. So I was still getting the updates, but it was definitely, I needed to kind of do a hard shutdown on the type of exposure that I was letting myself have with the COVID deaths, because it is negative, in a sense. It is frightening, especially when you're sick, because you don't want to be one of those statistics. For me, I know I am considered a statistic. I'm that one person in the New York positive, that tested positive. So I am a statistic in that way, but I didn't want to be a statistic, further down that path, let's say.
Thank you. Here's somebody who's watching right now who says that, what do you say to people who say this is a hoax?
What do you say? What do you say? I mean, some of it is, I just don't even have words. I mean, like I mentioned before, I'm part of these survivor groups. There's actually one called Survivor Corp in Facebook. It has about 50,000 members the last time I looked. I think it's probably even higher today. It is an incredible amount of people who've literally survived this virus. And many of them are what they call long haulers, where not only are they still struggling with just the remnant impacts of coronavirus and COVID and how it's kind of decimated their bodies. So everything from headaches, fevers, 100 days on. That's also something, actually, in some sense, I feel like the media is underplaying some of these things in terms of really not talking so much about the long haulers. And there's a huge percentage of them that have like racing hearts, lung pain, calf pain, rashes. And I'm talking about, like I said, beyond 100 days or 12 weeks and beyond, and they're still going. And there's a whole study that's dedicated to actually researching them and understanding why they have these continuing impacts of coronavirus.
And here's an article by our friend Sumathi Reddy in the Wall Street Journal. Meet the long haulers, the young and healthy COVID-19 patients who never got better. I interviewed 24 of them. Mount Sinai doctor says many may have developed post-viral condition, a neurological condition. And this is the thing, right? We think it's you get better, or you die. Like those are the options. And you're saying that there are people who, as we're seeing in the story, and everyone should follow Sumathi, who covers health issues for the Wall Street Journal. She's terrific. RDDSUM on Twitter is her handle. And just so difficult to think of this and think of the pain and our political leaders abandoning everyone at this moment. Some people have done the right thing, but the vast majority who should have been speaking up and fixing the problem just added to the issue here. Folks, we're about halfway through our conversation, and I know this is very difficult for Mrinalini. We are very grateful to her for being here. I'm just going to take her off camera for a minute, tell people what we're doing here, and so give her a chance to just kind of breathe, maybe get a glass of water and just relax for just a minute here. Thank you for joining us. My name is Sree Sreenivasan, and I'm the host of this daily COVID-19 discussion that we have around the world. We're simulcast on scroll.in, SCORLL.in, one of India's best news and culture and analysis websites. And we're very grateful to them for hosting us and allowing us to reach a truly bigger audience. And we want to tell you that tomorrow we have another episode that is talking to the folks at WHO. This is our 112th episode. On our 99th episode, we met the chief scientist of WHO Swaminathan, Dr. Soumya Swaminathan, and we also met Dr. Sylvie Bryant, who is the head of pandemics at WHO, and they were both here for episode 99. For episode 113, we're going to be talking about another aspect of this crisis. We're going to be talking to WHO to see how they're training folks around these issues. And we're going to be joined by Dr. Gaia and Christine Tretter. And Dr. Gaia is the person who leads learning and capacity building for WHO's Health Emergencies Program. And Christine heads the Global Internship Program at WHO. So we're going to ask them questions about how they're preparing and how they're teaching in the middle of this pandemic. If you have just joined us, please hit share right now so your friends and family around the world can watch and join. We're live on Facebook, Twitter, YouTube, and on LinkedIn. And all of those platforms, the recording will be available right after we're done. It will play again so that people can watch. And we're here every single day. Our next episode is at noon Eastern time tomorrow. That is on Thursday. So 24 hours from now, if you're watching this live, noon Eastern, 9:30 p.m. in India, and 6 p.m. in Geneva, where our guests will be joining us from. So that's tomorrow. Please do join us. That's episode number 113. Today, we're on episode number 112, and we're talking to Mrinalini as she shares her story of surviving COVID and the lessons we all need to hear. I'm going to bring up her article so that you folks can read it, and then we'll bring her back on stage also so that she can continue to tell us her story. Very brave of her. The only reason she's doing this is so that people can learn. And this is her story, her family's COVID experience. And she talks about, she says, where did we get it? And then she goes these statements one after the other. So that are, some of them are myths, some of them are problems that people don't understand. And here she is. Thank you again for staying with us and being here. And I know in the middle of the day, it's very hard because the kids are up and about and doing things. So are you like hiding in your son's room? Or
I am. Yes. Did the Lego figure give it away?
Yeah, it did. I'm very much like a detective now. And right now, what, let's pretend your husband's not listening. What do you want to say to him about how this experience together?
Yeah, I mean, I think, I've said it to him. I think he's just been an incredible rock through this whole experience. He not only had to take care of the kids while I was in the hospital, but it took me about 4 to 5 weeks to actually be able to comfortably move around without being completely exhausted. And I've never, like I said, I consider myself relatively young and without any issues. So for me to be down at that level, and not being able to physically move around or cook anything, or even just help with the 2 kids, giving them baths, putting them to bed, he literally shouldered all of that for 5 weeks straight. Luckily, I work for an amazing company, and they were incredibly supportive throughout the experience, and I was able to take time off. And it was frustrating for people like my mother and my mother-in-law and my cousins and my husband's family, because they all wanted so much to help us and they really felt with us. But at the same time, it just wasn't safe for them to be here. So my husband had to do it alone. And of course, he's somebody who's completely capable of that. But I think it's really made us appreciate our family and what we have and the life that we have. I think before COVID, you're frustrated with the kids, you're worried about them showing up on conference calls, and those types of things now just seem so meaningless, where if my kid asks me a question now, I have to mute and just say, I'm going to talk to my kid, because that is a priority. I mean, I almost thought that I would never see them again, and nothing in life is worth that. So, and for my mother, she's, as you know, Sree, she's already lost a child. So for me, that was just something I could never put her through. So I really fought hard for her as well to make sure that I stayed as long as I could for her. Yeah. So
very, very hard to think about all of these issues. And a big shout out to your husband. I hope he gets to see this. He's probably busy with the kids and can't watch.
He is, yes.
But also just to think that after all of this, you consider yourselves lucky to have gone through this pain and everything compared to other families who aren't able to be here and talk about it and share their pain and talk they're gone or they've lost somebody. And here you are. After all of this, you consider yourself lucky.
Yeah, no, definitely. I mean, I think the fact that I've been able to come back and have such minor, as I said in the beginning of the call, like bites from COVID still haunting me. And I think, being a part of these survivor groups on Facebook and really understanding what people are struggling with and how serious these long-term impacts of this disease are if it really gets into your system and you're not careful, you don't go to the hospital at the right time, you don't catch it at the right time, you ignore it, you think that you can fight it on your own. In some instances, people can, but for some of us, that's not the way that it works. And I was lucky to have to go into the hospital at the right time, have the amazing care that I did at New York Langone, and really, really ensure my future health as a result of that great timing. My kids, and this was the other thing I wanted to just mention, is they have had remnant impacts of COVID. They had the initial fever for the first day, but after that, they had a kind of an aftershock, if you will. 4 to 6 weeks later is the time that kids, you'll see that in the kids. It is typically considered an inflammatory reaction to COVID, not as serious as the multi-inflammatory syndrome in children that is more widely reported in the media. But there are so many children who 4 to 6 weeks later after having some bout of COVID, they are seeing rashes and fevers again. So it's almost like the body's last hurrah in kind of kicking COVID out of the system. And that, I think, is what, again, is a very stressful time for parents, because you don't know if it's going to turn into that multi-inflammatory syndrome, which was something I was really scared about for my children. I've also spoken to and connected to a ton of parents, and it's actually a lot more common than you would think. I think there's a lot of misdiagnosis because we were, in the part of that first wave, in a sense. So a lot of pediatricians have never seen it before. So they're kind of actually diagnosing it as hand, foot, and mouth, or roseola, because often the rash is on the cheeks. But it really is this post-reaction to COVID, because children's immune systems are so different. And again, that's not something that I think is widely covered in the media. From the survivors groups that I'm in, it seems like really common occurrence, but obviously that's a very targeted audience. So I don't know what percentage of that. And I think all of that data, like I said, is still in motion. They're still getting it. From what I understand from the pediatricians, they do have CDC guidelines and research that they're actively going through. So to the parents, I would say, make sure you're talking to a pediatrician who is well-versed in the research and is kind of actively ingesting the research every day or regularly, because it changes. And there is one of the benefits of this is the medical community is really kind of pushing out research papers really quickly. So just be sure to have and be in touch with a pediatrician who's really actively on top of it to make sure that your kids remain safe and at least you know what's going on with them, so you know what to watch for.
Thank you. And we want to underline that your experience is your own unique circumstances, and everything that you're sharing is from your personal experience. And everyone, we're talking about 7 billion people can have 7 billion different ways of encountering and connecting with this. So I encourage everybody to talk to your local personal doctor and physician when you can. So one of the things I thought would be helpful is I reached out during the show as we're speaking here at the idea of reaching out to our doctor on one of our on our show. She's on call, and Dr. Marina Kurian is going to join us for a couple of minutes just to talk to you and talk to us about what we're hearing from you on their show. I'll just remind everyone who may have missed this. This is their show. It's called She's on Call, and these are two surgeons in New York, Sujana Chandrasekhar and Marina Kurian. And Dr. Kurian is here with us. It's a show that's on Sundays at 11 a.m. Eastern, and I'm just going to bring her on to just say hello and just respond to, as we look at that article together, what does all this mean for all of us who are so concerned and so worried about all that's going on. Hi, Marina.
Hey, how are you guys? And congrats on hopefully getting mostly on the other side of that infection.
Thank you.
Yeah, and it is a long haul. I mean, I read your essay, and it definitely is a 4 to 6 or longer deal. One of my colleagues got it early, and she feels pretty normal. She's back running and working out, but I think that also is variable. Like, people still talk about. I might have missed the beginning of your comments about these little bites that you still get from COVID. I think those like the little pinching feelings that you have either in the lungs or the aches that you might have down the road these 4 to 6 weeks. I think it is so great that you put that out and shared your story, because everyone thinks it's going to be somebody else until and all the families that have encountered COVID and have lost someone, we're trying desperately, not just the lay public, but the doctors, to figure out who's going to get it severely, who's going to get it, who's not going to get it. And we keep finding little pieces. And as I've said before, we have such a trove of information, and the research is going to be fantastic. But unfortunately, we're just identifying factors and not being able to say that there's something that we can give that's preventive, except, right, wear a mask, practice social distancing, wash your hands. And I saw too that you thought perhaps the way you got it might have been just something randomly touched outside and or walking out when there was a delivery guy, because you were on lockdown pretty early. So that's.
Yeah, we were. I mean, I live in Hoboken, and our mayor was actually one of the first to actually, shut the town down, if you will, and shut down daycares and all of that. I believe we were shut down March 13th, if I can remember correctly. So yeah, we really didn't have much human contact. So that was a really surprising, or we didn't have any human contact. So that was a really surprising factor. And yeah, like I said, we thought we were incredibly careful, but it's so hard to tell where it came from.
And I think as we open up, and we had on one of our shows posted this whole thing about what we consider our low risk for contracting a disease, like distancing outside, being outside versus being inside. So it is so complicated, and it's also interesting that all of you got it. Right, like even though the symptoms vary greatly,
yeah,
there have been other families where one person got it and no one else was sick, no one had antibodies, and also that was interesting. You looked at the antibodies that one of your sons doesn't have it, but the pediatrician is pretty convinced that your other son did have it. And that's the other thing. We're looking at these antibody tests, and what we can say in general is a false negative rates are probably higher, but if you have antibodies, then you had it. That's true. And if on your PCR testing, which is where they're doing like a deep saliva test, but before they were putting that swab down the back of your nose deep. That's not comfortable having undergone that. But those are actually testing, and if it's positive, then yes, it's positive. But if it was negative, there was up to a 30% false negative rate, which is concerning. And when we look at all these antibody tests that the FDA just recently another one, and then there's a fast test as well. I think that, again, if it's positive, then it's real. If it's negative, you might still have it. And if you're feeling sick, I think the key is to go into into a quarantine.
Yeah.
Go ahead, Menon.
No, I was just going to say my children had the blood test for the IgG and the IgM. But yeah, it was really strange. But I've heard that across the board in terms of there's been a lot of families that we've heard have had there's a mom who had a very similar story to me, who reached out to me after she read my story. And she said the exact same thing, that her and one of her children had positive antibodies, and then her husband and her child had negative, even though they were all sick. So yeah, it's very confusing. But to your point, I think it might be the testing or still a lot to be discovered.
Can I ask the doctor, watching the headlines and watching these numbers go up and up and up, how does that make you feel? When we were planning your episodes of your show, by now we expected, some portion of the discussion would be COVID-19, but people would have gotten the message. How are you feeling? How are your colleagues? I see you're you're at your office right now. You're in a different setting than when we usually do our show. So talk about that a little bit, please. And I know you have to go in a few minutes.
Yeah, I think, what is it? There's so many people out there. There's a hashtag wear your effing mask, right? I mean, wear the mask. It's not. Wash your hands. Get your Purell on board. What's great, and I've always said, I'm a proud New Yorker. I've never been prouder of New York. I think the governor has done a fantastic job in getting the message across. Actually, I get colleagues from around the country going, "We love your governor." Like, yeah, I know. I mean, he's not perfect. Right, but no one is. But he has really done a great job. And when we look at the number of patients that we're seeing currently, it's so low. But we still have some patients that are being hospitalized, but very low number. And what's nice is the transparency that we can get that from the state, and the hospitals are reporting it, which is so important. What we're seeing in other parts of the country is just this: what happens if don't practice social distancing if you're not as careful as we have been in New York. And, people have taken the subways. Subways are being cleaned. We have 8.3 million. I think it's higher because, undocumented, right? But we have so many people here, and we were able to crush this to not even a roar, just like a dull, like a meow right now. Thank God. Doesn't mean that we're off the hook. Doesn't mean that anyone across the country is off the hook. We still have to be watchful. And originally, we were all hopeful that there would be a vaccine in September. And it's looking really like January, which is why I think a lot of the tech companies and finance, they're like, no one's coming back in the office until January. The hope is that there will be enough vaccines for it.
I know we'll lose you in just a minute, but Terry Ann Thompson's watching from Vegas, and she says, I booked a flight from Nevada for August 4th. Should I cancel, doctor? Is it safe to fly? She's asking.
So you'll have to look at what's happening in Nevada, but actually getting on the plane, I flew recently. It was totally fine. I didn't get sick. I came back. Everybody was wearing masks on the flight, so that was good. And then also getting to the airport, going through the airport, the gate agents, everybody was wearing masks, and then I had Purell with me, and I think it's safe to fly. But is Nevada like a high peak state right now?
I'm not sure. They opened up the casinos, and you remember the mayor was demanding that. So this is it's up to everyone, and we have to be very careful. You must make your own decision on these things. And August 4th, in some ways, is a long way. Very far away, but we've also heard from
5 weeks away.
Yeah, Dr. Fauci, as well as from the head of the CDC, that we have a very narrow window here to fix this. Otherwise, it's going to get much, much, much worse. I do want to say that there are people who are using the argument that has been made by many people that isolation is causing more damage, the economy, as well as mental deterioration, as this person puts it here. He's insistent that it's whatever physical damage there may be, we're not counting the toll. This is a common thing said by everybody who wants to open up. Your thoughts, doctor, and then we'll let you go, and then we'll go back to talking to Mrinalini.
Yeah, so there is something just recently I read talking about how 1 in 4 Americans are saying that they feel a lot of issues, and that their mental health has worsened being in quarantine. I was hard into quarantine. I did it very early. I didn't see patients. I already had telehealth set up, so I just started seeing patients like that. But there is a lot to be said for being physically with other people. Even though I quarantine with my children, they're teenagers or young adults, and they don't get up till 2. So I had all these hours, and I was like waiting for someone to just wake up and come out and talk to me. Because I was joking that I was the extrovert's extrovert, but it was very, very trying, very hard. All my friends were texting and calling. And I'm a professional, I'm a health professional, but I still felt it, and my friends knew that about me, so they would call and FaceTime just to make sure that, because I think it is important. You do need to see people. We're not hermits. And being in quarantine can be so debilitating in many ways. And then there are all these worries, right? Like, will I still have my job? Like, opposite. When can we actually get out and see family? All these weddings that got canceled, receptions that are now moved to the future. Is New York going to be the same? All of the restaurants that may or may not reopen. I mean, we're looking at a new world, and I don't know if it's a brave new world or scared new world. I can't tell, but it's definitely very different than what we've expected. And I know that Dr. Fauci has said that we're going to, unless we do something, we're going to see another 100,000 cases. And I think that that's true. I think the governors should have all gotten together and been on the same page. They didn't do that. And the politicization of a mask. Here it is. It's ridiculous. This is wear the mask. Wash your hands. What? There's no bravado in this. And then people, the good news is that people are sharing their stories like you have. Another good news, this guy was said it's all fake, COVID's not real. Then he got it, and he immediately actually got back on social media and said, no, this is real. This is devastation. Everyone take this seriously. And we can't let our guard down, mainly because we don't have a cure. We don't have a vaccine. We don't exactly know how to treat it super well. I looked at your cocktails that we call it a cocktail, right? Your medical cocktail of all the things they gave you.
Yeah.
And one of my colleagues, ophthalmologist, was admitted at a different hospital, and all the hospitals have like slightly different regimens. And so he actually got remdesivir,
Right.
Other people didn't get it. And there's another one called Coletra or something like that they got. So there's different cocktails, and everyone was learning on the fly, which is not what you want to hear from the medical community, right? I get that. I don't. Yeah, I'm going to just make it up today. I have a case later today. I'm going to make up this operation. That's not what you want to hear. But unfortunately, this is not following usual patterns. I mean, the mere fact that in kids, all the pediatricians are, and unfortunately in your family, you saw as well that they are peaking or having different symptoms 4 to 6 weeks later.
Yeah.
Very unusual, not usually seen in childhood illnesses. So this has been eye-opening, and it's shown us how we're just not really prepared. And it's also amazing, right? Who would have thought, even March 5th, I was like, they're not shutting down New York.
Mm.
Oh yeah, they shut New York down. I mean, the state, the city, everything was really, really shut down. And this has shut down the world, really, as we know it. But I think it'll come to pass and get better.
Ellen says that our president should set an example and wear the damn mask. And Terry says that cases are rising in Vegas. So that was your question. Is it rising when you decide? And we also have Tanya saying, is it safer to drive? A lot of people feel that way, that somehow it's safer to drive because it's an environment you control. It's your car. You wipe everything down. Do you feel that way? I know you're driving, Doctor.
I drive. Yeah, I have all these satellite offices that I drive to. It's hard to say, because if you're driving cross country like that, that's a 3 to 5 day trip, and you're got to make stops at different areas. So now you're introducing more variables rather than a 5-hour flight where you can control your environment. Bring wipes with you or Purell and just wipe things down. So I don't know if it's safer. I think that all of the airlines have done a really good job updating whatever the filtration system is, and also cleaning and using the appropriate cleaning solutions on the airplanes. So I actually think flying is okay. I felt completely safe. We don't have any documented cases of patients people getting sick from a flight, certainly after the realization went out. And people are flying. I mean, they're reduced flights, but people are flying every day.
All right, we need to let you go. Mrinalini was treated at NYU Langone, where you're also affiliated there, and so that's a nice coincidence. And folks, everyone, please watch Dr. Kurian's show. It airs every Sunday at 11 a.m. Eastern Time on Facebook at She's on Call. On July 12th, they have Dr. Quinn Capers joining us, and Dr. Susmati Pati will be with them as they host She's on Call on Facebook. But you can also see last week's episode on She's on Call on Facebook and on Twitter at She's on Call. Thank you very much, Doctor.
Right.
Good luck.
Bye.
Thank you for staying and listening. I hope that was instructive to you as well. Everybody is learning from this, and you have taught so many people, Mrinalini, with your story. Can we just quickly look at the parts of the story that
Sure.
you highlighted? You said statement 1: men get COVID worse than women. That's what I have been told.
So, I mean, the truth is I did not get that. As you could say, tell by my case, my husband had fever the first day. And then he had tremendous body ache, really tremendous body ache. And he's not somebody who gets taken down by anything very easily. So the fact that this took him down to a point where it was hard for him to get up to go to the bathroom is crazy to me. But so he did have that, but obviously I ended up in the hospital. So I can say that was a false statement for our family, at least. Again, not a medical opinion, just our own.
And by the way, we know that not everybody knows, even the medical opinions haven't always been correct about all of these things. So let's keep going. The next thing here is kids are minimally impacted.
Yeah, this was kind of referring to the point that I made earlier in terms of, my kids did have a very minimal reaction in terms of just having fever for a day. But later on, they had rashes that had lasted weeks. I've also spoken to a couple of moms who said that the front end experience was, kids being sick for 2 weeks with fever and diarrhea and really being severely impacted, not like a light experience, which is kind of what we've been told to believe. And then also having that post experience with the fever. There's some kids, there's one mother who I was talking to, and I think her child still has fever and is still not 100%. There's so many stories like that of fever, of sometimes those are older kids, but older children not being able to kind of level up in the same way and almost having that long haul type experience that the adults are having as well.
Thank you for clarifying that. And again, I keep repeating this, that this is all, your experience.
Yes.
People
Correct.
with underlying conditions get it more intensely.
So like I noted, my husband has blood pressure. I do not have any underlying conditions. I have never been treated for chronic illnesses. The only thing I can think of is I have seasonal allergies. So yes, that was definitely false in our family as well. I was really scared for my husband, but it ended up that I was the one who kind of got myself in a deeper COVID pit.
And why you wrote this? Tell us about that.
I think just, to your point earlier of like, what do you say to people who've worn masks or who don't want to wear masks or who think that, this is a myth, that it's a falsehood that, is created by, the fake media, the fake news. The truth is that it's not. And like I said, there's, survivors group that have, 50, 60,000 people just go on there and read their stories. They're heartbreaking and heart-wrenching, from everything from losing people to having these long health struggles, having chronic illnesses as a result of this. There's so much unknown. I mean, my advice is be educated, be smart, if you're not smart, hopefully you're strong. But the truth is, why take that risk? Find out everything you can. And there's a lot of information out there. A lot of it is scary, but the truth is, we're dealing with this and there's no cure and there's no vaccine. And that itself should just tell you. I've literally told my mother not to leave the house till there's a cure or a vaccine. That is my advice for the older generation, especially more than anybody else. For the parents that we love, there's no reason for them to be outside and not socially distancing. I know they miss their grandkids, but it's not worth 1 year or a couple months of inconvenience and not seeing your family is not worth your life, is my opinion. So.
Yeah, and you're absolutely right. My dad said, today's success is survival, and we are happy you are successful in that sense, that this is really so important. Mark says, you and your family are so strong. I'm shocked at colleges and schools that are rushing to reopen. I think we really should do virtual education in 2021 education year. Naveen's watching and says, we'll check out Sumati Reddy's Wall Street Journal article as well as Mrinalini's essay. Thank you for sharing them. Again, Mrinalini's essay can be found. You can see the URL right on the screen. It is bit.ly/COVID essay so that you can learn from her. And Kat says, you are the strongest. And is this? It's
one of my nicknames. Yeah, Pinks.
Okay,
I know her. Yeah.
Good. And Mark has joined us for this important conversation on his birthday. Happy birthday, Mark. And we should really celebrate every day that we are all getting through this, and those who have, and at the same time mourning 125,000 deaths. Again, that statistic. America has less than 5% of the world's population, but a quarter of the cases in the world is shocking, stunning. I think it's the quarter of the deaths in the world, maybe the number, but whatever it is, just like the other comparison you make on that is America is 5% of the world's population and 25% of the world's prison population.
Right.
And something is wrong in the American system. Can you just talk about your healthcare? How were you able to pay for all of this? How did that work? And as you said, the president is at this moment preparing to attack Obamacare and get it overturned and shut down in the middle of a pandemic. Who does that? The cruelty here is the point, as we have spoken many times on this show. Please tell us about your healthcare situation.
Yeah, I mean, I was very lucky. I work for a great company. I have really comprehensive healthcare. So the truth is, I wasn't hit very hard and was, again, very lucky in that instance. But I saw a story a couple of months ago, again, from the survivors group, where somebody had said that had literally posted her heart rate, and it was incredibly high. And people were advising her to go to the cardiologist. And she had literally said that she was saving up money so that if it came to a really bad scenario, in order to see it, because the scans or the EKG is $1,000 or something like that for that visit. And so, there are people who are really struggling at this time, who are sick and who don't have the insurance to pay for it. So, and as a result, like I said before, I really think that in those scenarios, there could be chronic cases as a result of that, because I think I got lucky because I had such amazing care and I had such amazing doctors who were willing to jump on the phone with me for every ache and pain I had. And I have the resources in order to be able to pay for that through the insurance that we have. So the fact that Obamacare is even a question in the middle of a pandemic, which is such the biggest health crisis we've faced as a country, is just unbelievable. It's unbelievable to me that this is even being it's just even being considered. Like, it's crazy.
Our friend Jacqueline Dolly, who was a guest a few days ago, all the days are blending together, as you know, Mrinalini.
Yeah.
She was talking about careers and what we can do. She says that this speaks to the cultural differences as well as systemic issues and poor leadership in America. If you could speak to two groups of people, the president and the vice president, and to everyone who thinks this is a hoax, thinks this is not real, thinks it doesn't matter, we must go out more than anything else, what is your message to both groups of people?
I mean, I would just say people are dying. People are sick, and there's some people who are going to be continued to be sick. This is serious. This is real. Like, this is not a political agenda. You literally have the number of deaths in front of your face. I think the president has done a terrible job in curbing those numbers. I really feel that so many more hundreds of thousands of people would have been saved had there been a more strategic approach, not only from a preventative methodology, but also just in joining the research and being more collaborative with global organizations. I just don't know, if you don't see the deaths and the numbers, and if you don't understand that this is a crisis and not just a flu, it's just beyond me that this is even something that needs to be said, to be honest.
But here we are, and we're saying it, and we have to say it again and again. Tanya says, I think diet is one of the biggest variables that separates us from the rest of the world, from pesticides to processed foods to acidity, including from alcohol. I'm waiting to hear about a study of diet and how it affects people through all of this. How are you eating? What are you folks doing? Have you changed your diet in any way?
Yeah, I mean, I think when the children got sick, and some of the things I learned from these survivor groups, I think that what's interesting is sometimes there's a lot of information out there in these groups just because people are trying to share and get ahead of it as much as possible, and you're not getting that quick enough in the media or sometimes from certain doctors, so they're trying to share it. And I think one of the things that I did adapt was like this anti-inflammatory diet. So really looking at removing dairy and trying to go gluten-free. For the first couple of weeks, we really kind of stuck to that. And I think it helped, especially for the kids. But we have now kind of reverted to a regular diet. But yeah, I mean, I think it is systematic in terms of overarchingly how we treat the earth, right? In terms of we're encroaching on wildlife, we're getting these diseases, the zoonotic diseases that are then jumping over to our side and kind of infecting humans. This is not my area of expertise, it's just my own opinion. But I think we just need to be really careful of what we do eat and how it's produced and manufactured and how it's impacting the environment. Because I don't think this is the last pandemic. I think there will be more, if we're not careful.
Shabani says, thank you so much for telling your story, Mrinalini. You're so strong, and this has been so helpful and moving, and I completely agree. I have learned so much. Ashok says, inspired by your courage, really proud of you, and people are just commenting. So many nice comments coming in. Important program, also important to put human faces to the pandemic. The numbers are numbing for all too many, and that's really, I'm just looking here if I can pull up and show everybody this. This was just on May 24th. So 5 weeks ago, we had 100,000 people die, and the New York Times put this, had this laid out like this. And since then, we've lost another 25,000 people. They only did 1,000 on this, 1,000 people to speak for the 100,000 people, and another 25,000 people have died. That's just in America, and we're seeing 50,000 deaths in Brazil, for example. And we're so grateful that you did not become a statistic, and you're here to help. I hope this is in some way, as you lead a normal life going forward, are able to continue to speak on behalf of so many people, but mainly behalf of your own family, and to advocate for folks who don't understand science, don't want to understand science, and are being led and misled deliberately. And we see that in every country. So I'll give you a chance to give us a final thought, and just on behalf of all of us, thank you for your time and your energy and your smile in all of this, because as we said, we have to smile at least a little bit.
Yeah, I think, it's tough. I mean, I think, just you showing me that paper just kind of takes me back to that moment, the first time my family ventured out to take a walk, and I was really frightened, just because, again, the emotional side of this is that your anxiety peaks. You are worried. You're worried when your children get sick and you're still sick. There's a lot of emotions that run through your mind. And you also are still wondering, am I done with this? Is it left? And is it still going to come and get me, because you're not feeling fully well. So there's a lot of emotional stuff. And the first time we went for a walk after I was allowed out of quarantine, I remember walking outside, and it was so crisp and beautiful because there's no pollution in the air. And it was such a beautiful day. And I just remember crying inside and trying not to cry in front of my kids, but because I felt guilty in a sense, but also sad for all the people who didn't get to see that moment, who didn't get to enjoy that day. I felt incredibly lucky, but also incredibly sad for those people who didn't make it, who didn't end up being survivors like me. I think, I think from an emotional perspective, it is a really tough struggle. It's not just, like I said in the beginning, it's not just one part of the disease. Anybody you love, you might not wear a mask. You might think that it's fine to put your life at risk. But when someone you love gets sick and you feel responsible for it because you've spread it to them, and you see them struggling in a hospital or actually, dying, I think that's when it becomes a reality. And it's sad that that's sometimes what it takes. But I have also seen, I think the doctor mentioned there are so many people who haven't worn masks and haven't, have been proponents of the hoax, and seeing them post afterwards and saying, I was an idiot. I really did get sick. But yeah, I would say to everyone, please be safe. It's not worth it. I know that it's hard to be cooped up in the house, but your health, we take it so much for granted. And this is something you really need to protect yourself. You cannot take your health for granted. If you don't have your health, you have nothing. So, and your family. So you need to just do what it takes to kind of fight through this.
Thank you. And Johnny says, proud cousins watching from Bangalore. And I don't know, do you guys make time for like Zoom calls and stuff like that with family? Or?
I am in touch with them very often.
Yeah,
yes.
good.
We have a WhatsApp group that I bombard with information all the time. So yeah, I'm the oldest.
And WhatsApp has so much good information, but also a lot of false information. And
Crazy,
so you try to do your bit to keep the information honest on there. Stefan says, stay strong, sending love. Loving thoughts your way. Wear your damn masks, people. Stop putting people in harm's way. And look at this guy. Abhishek says, go to the beach and enjoy your life. Don't worry about this. This is not real. I mean, he and others are responsible for where we are today, but they're led by our leaders who are not showing us the right path. And very, very tragic. And so many comments. I hope, Mrinalini, when you have time, you'll go through some of them and maybe reply to them, because so many people are sending you love. As Rahadyan here is, thank you for telling your story, both in the essay and in this forum. Blessings to you and your family. And I can tell you that Rahadyan has shared earlier on this show, in other episodes, that his mother, who was a nurse for 50 years, was retired and elderly and living in a nursing home, and he saw her a few weeks before she died. She died of coronavirus, and he, like so many of us, feel like that sacrifice was for nothing. It's just so tragic. The way we've been moved by George Floyd's death to do things around the country. We now have 126,000 people who've been killed. You think the government would be moved. You think the governor of Florida would be moved, but they are not. And that's where we're in this tragic situation. Mark says, thank you for sharing a very poignant story. And Ashok says that Mrinalini is the granddaughter of KPP Nambiar, founder of Keltron, major Indian company in the state of Kerala, where my family lives. Jacqueline says, so many people are in denial. Thank you for sharing this story. And so now two of our speakers have connected. I can tell you, Mrinalini, we've had more than 200 speakers on the show, 200 guests, and each one of them has taught me so much, and you have done that today. We will let you go. Your family's waiting. Your husband's probably knocking on the door. I don't know if they're actually hiding below the camera right now, trying to get your attention. Are they tugging at your dress there? But thank them all for bearing with us. And I asked you for a few minutes, and now here we are, an hour and 18 minutes later. You've been wonderful. Awesome. Thank you. God bless you and your family. And big shout out to the hubby as well.
Thank you. Thank you so much, Sree.
Okay, we'll say goodbye to you. Folks, that was Mrinalini Nair, such a brave woman, to talk about her and her family. She has no reason to do this except to share her story. Everyone, please check out the column. It's on bit.ly/COVID essay. It's also in our Facebook. It's on Twitter, bit.ly/COVID essay, bit.ly/COVID essay. Please read it. Please learn from her, as we have been learning today. And as we want to remind everybody that in 24 hours, now 23 hours, we have two guests from the WHO who will be with us. Part 2 of our talks with WHO. We have the doctor who's leading learning and capacity building for the Health Emergencies Program, and the director of the Global Internship Program will be talking to us tomorrow at noon Eastern, 6 p.m. in Geneva. So please join us for that session. Before we go, we tell you that I interviewed Kimberly Crenshaw, a professor who coined the term intersectionality, and we asked her, what can we do as allies in the battle for racial justice? And she said, you have to say their names. And so for every episode since then, we've been saying their names, and I'm going to do that right now. And thank you all for those who are able to stay and participate. This is a cover of Time magazine by Titus Kaffer, of a child taken away from his mother. You can see the portrait on the left. And on the right is a photograph of a young George Floyd with his mother, Larcinia, who would die 2 years almost to the day since he was killed. And then they're buried together. He would die 2 years after she did, and then they would be buried together in Houston. He was killed in Minneapolis, as you know. And these are the names: Trayvon Martin, Yvette Smith, Eric Garner, Michael Brown, Laquan McDonald, Tanisha Anderson, Akai Gurley, Tamir Rice, Jerame Reed, Natasha McKenna, Eric Harris, Walter Scott, Freddie Gray, William Chapman, Sandra Bland, Darius Stewart, Samuel DeBose, Janet Wilson, Kaylin Rockmore, Alton Sterling, Philando Castile, Joseph Mann, Terrence Crutcher, Chad Robertson, Jordan Edwards, Aaron Bailey, Stefan Clark, Danny Wraith Thomas, Antoine Rose, Botham Jean, Tatiana Jefferson, Michael Dean, Ahmad Arbery, Breonna Taylor, George Floyd, and of course we must add to that list Rayshard Brooks, who was shot and killed in Atlanta, shot in the back on video, as you all saw just 2 weeks ago, and just very, very sad story. We also, one of our guests was Ryan Boodoo, who says his elder brother, Ravi Boodoo, was killed in police custody and blames police violence for his death. And you can read his op-ed in USA Today, bit.ly/Ryan op-ed. And Ravi's death led to Ryan becoming a lawyer, and another brother becoming a doctor, and a sister becoming an activist. And we thank you all for watching. As always, we're looking for your guest ideas, speaker ideas, sponsor ideas. We are very grateful to Scroll.in for simulcasting us and for giving us this room to tell the stories of this crisis from around the world. A reminder that tomorrow, that is a previous episode. You can find all our archives on youtube.com/Sreenet. You can see it on the screen, youtube.com/Sreenet. And this is our episode tomorrow, episode 113, where we talk to WHO about how they do training around the world. The other thing I wanted to tell you is we have this WhatsApp code that you can use to join not a WhatsApp group, but a WhatsApp alerts list. And so you get an alert every time I'm live, just right on WhatsApp, and hope you will sign up for that. Or please go to YouTube and please subscribe Sreenet on YouTube, and please connect with me on Twitter @Sree, SREE on Twitter. And just very grateful to all of you for your support and for being here with us through this crisis. Let's see a final few comments coming in here. Monica says, thank you so much for your insights. Thank you to Mrinalini for that. Mark says, great story that we need to hear more about. On a lighter note, I love your musical shirt. You have to tell me about it. Yes, so I want to tell you that I'm wearing this very informal shirt for such an important conversation because this says Trinidad and Tobago. I was supposed to be in Trinidad this week for a conference, work, of course, and I'm not there. I'm here, and I wanted to wear that shirt as I think about where and how and what we've lost. And that's why I'm so angry about how this president has treated this crisis from day one and where we are right now in the world. He wanted to be the greatest and the leading country in the world, and here we are, leading in deaths, leading in cases, even after we have not bent the curve enough. We've not flattened the curve. We bent it a little bit, and then lying about it every single day has caused us to be where we are today. Wear the darn mask, Mr. President, is what I would say to him. Wear it on TV. You will save. I know you don't care about all of America, but you will save your own base. You care about your base, save them. Wear a mask on TV today. Please do that. Anybody who supported this president, even knowing all the racist and terrible, sexist, misogynistic attacks and everything he did, you voted for him because of the tax cuts. You voted for him because you liked his rhetoric. Whatever it is, come get your boy. That's what I say to you. He is responsible for the deaths of thousands of people on his watch. And you are seeing the result of how misinformation, disinformation, lies, all of that result in the situation we're all in now. And we are all going to pay the price, and we're paying the price already. 125,000 people have died in America. This was when it was just nearing 100,000. And so I'm just so upset and so angry. My mom's watching from Kerala. Hi, Amma, love you. Thank you for watching. Thank you for being such a great supporter of everything we do and I do. Really grateful. Ellen says, thanks, Sree. And Leica says, it's nice to see Mrinalini, who I knew as a 3-year-old when they came to visit New York City. And I'm sure she will see that comment, Amma, and she'll be very happy to see it. With that, we'll say goodbye to everybody. Thank you. Please be in touch. Please email me, sree@sree.net, SREE@SREE.net. We'll see you soon, everybody. Tomorrow we have a big show. We want you to meet our friends at the WHO, World Health Organization, live from Geneva. Dr. Gaia and Christine will be here. They lead learning and capacity building for WHO's Health Emergencies Program, and Christine leads WHO Global Internship Program. Please do join us. Thanks very much, everybody. We'll see you very soon. And check out our archives, youtube.com/SreenET.